We have Dr. Randy Semple with us today to tell us about mindfulness therapy and the treatment that is being funded, treatment research that's being funded by the Addis Family Foundation and Danny Alberts Foundation. One of the questions we had was just to find out what made you, how did you get interested in mindfulness therapy?
Mindfulness-based therapies are fairly new. They've developed in the last 15 years. And I've had a personal meditation practice for several decades. I found that as I was moving into graduate school, this was becoming an area of research interest, and I found pleasantly that I was able to merge my personal practice of mindfulness into professional work. The amount of research that's going on in mindfulness-based therapies now is increasing exponentially, and it's being used for a lot of clinical problems like clinical depression and anxiety, and now we're working with treating bipolar disorder. But also it's moving into the community for general stress management and everyday living skills.
You worked with perinatal women on this recent project. And they were women that had a history of depression and bipolar disorder. What could you tell us about how the treatment worked for them?
This study was an evaluation of mindfulness-based cognitive therapy for perinatal women with mood disorders, with depression and bipolar depression. And we found that the women participating first, they were very motivated to participate. You may know that many of the psychiatric medications that are used for treating particularly bipolar disorder can have harmful effects on a developing fetus. And so these women are very motivated to look for alternative treatments. We did not encourage them at all to go off their medications. However, we found out afterwards that several of them did and felt better for it. This is at the very, very early stages of research, but overall we got markedly positive response from the subjects. I found that they were taking it into their everyday life in ways that were very immediate, including their relationships with their partners and their relationships with the kids that they already have. And because of the motivation, I think they developed a very cohesive group very quickly. And we got uniformly positive responses afterwards.
That's fantastic. What can you tell us about the next projects that you're looking into or planning with the Danny Alberts Foundation?
Well, one of the projects we're looking at is to adapt the mindfulness-based cognitive therapy for treating adolescents with bipolar disorder or with symptoms indicating that they're at risk for bipolar disorder. It's a big problem and can lead to a lot of future problems, delinquencies and drug and alcohol dependencies and so forth. And so early treatment is essential. And MBCT, or Mindfulness-Based Cognitive Therapy, is a resiliency-based program. It's a skills training program. And if we can head off the episodes of depression or mania earlier, they tend to be less worse and less frequent down the line.
Thank you.
You're welcome.